Hi, I'm Dr. Sri Ganesh at Netadama Eye Hospital, and I've been using the SL800 slit lamp from ZEISS. This is the top-end slit lamp from ZEISS, and I've been using it for the past 6 months. I've used a lot of slit lamps in my 25-year career as an ophthalmologist, and I think this is one of the finest slit lamps I have used. The slit lamp is the most important instrument in the outpatient of an ophthalmologist, and this is an instrument which we use day in and day out. So I believe in having the best slit lamp with the best optics and illumination, because it helps us diagnose conditions and also educate patients. So let us just look at some of the features of the SL800, the new slit lamp from ZEISS. This is a digital slit lamp with a host of features. It's not only a slit lamp, but also it is a photo slit lamp where you can also take videos and photos for patient education and also for research and academic activities. Now, the advantage of the slit lamp, first and foremost, is the optics. It's got what is known as the true view optics, which is world-class optics, and it's one of the finest optics that I have visualized with, and it has apochromatic optics and anti-reflection coating, which has a very high transmission of light, and it gives you very high resolution and also contrast to visualize even the smallest details when you're looking at either the anterior segment or the posterior segment. Coming to the ease of use, this is a slit lamp where they have made certain new features which helps you use the slit lamp with one hand, and you can also change the magnification, you can change the illumination, you can do your captures with a single hand, and your other hand is free for various maneuvers. If you want to hold a lens, or if you want to retract the eyelid or do some procedures on the eye, then your other hand is totally free. Now, if you look at the ergonomics of the slit lamp, it's very smooth and easy to use. It has a joystick like all other slit lamps, which help it move up and down and in any direction. But then it also has auto zoom or auto view, which has plus and minus buttons here, and this changes the magnification. So it has got a 5-step magnification, 6x, 10x, 16x, 25x, and 40x. And so just by pressing the button, you can either increase the magnification. This plus button is a convex button and the minus is a concave button. So just by the feel, you don't have to look at the buttons. You can just feel the buttons, and then you know whether you want to increase or decrease the magnification. The plus automatically increases and the minus reduces the magnification, so you can hear the clicks. And then it has got the illumination rheostat here, which you can very easily turn to reduce or increase the illumination. And also it has what is known as the electronic brake here. So as soon as you press it, it locks the slit lamp. So the advantage of the electronic brake is just you can lock the slit lamp and then it remains in this position. Suppose the slit lamp is on and you're not put on the electronic brake. Many of us forget to put off the slit lamp, but this slit lamp has something known as the eco mode or economy mode. And if you forget to put off the slit lamp and you're busy, then after some time, if you're not used the slit lamp automatically puts off the illumination, and then it puts on the electronic brake so that the slit lamp does not move. And these are some of the new features, and let us look at how the magnification changes and how you can change the illumination. It also has a capture button on the joystick. So just by pressing this capture button, you can capture either a video or the still image. So it's very useful. You don't have to use your other hand or do any other maneuvers. Click on the button and the magnification reduces. For the reduction, this is 6x magnification. Then I can increase the magnification. This is 10x and 16x, and this is 40x. So if you want to step down, you again press on the button, and this is 25x magnification. You can see that the resolution and the illumination is excellent. You can see the finer details, and this is one feature where you can seamlessly change the magnification without actually using your other hand. You can also reduce or increase the illumination, and you can record. You can also do a capture with one hand. So this is something which is very nice in this slit lamp. The oculars are standard, and then of course it also has a vario fundus viewer which you can change. This is for anterior segment, and this is when you want to examine the posterior segment. What it does is it reduces the stereoscopic angle from 12.5 to 7 degrees, and this improves the binocularity and makes it very easy to examine the fundus. So this is also a special feature. It also has various filters. Coming to the illumination, this is the illumination tower, and it's got an LED illumination which is bright white, and we prefer the LED illumination which is actually cold white light, slightly bluish, for anterior segment examination, so that you can see all the finer details. And then for the fundus examination, you can always switch to halogen, which is a little warmer light and more comfortable for the patient and better for fundus viewing. It also has a red-free filter to examine blood vessels, and then you have the cobalt blue for fluorescence staining. Along with the cobalt blue, you also have the barrier filter, yellow filter, which is here, which you can just pull up, and it brings in the yellow filter that enhances the fluorescence staining. And it's got also a red filter. The red filter is useful for examining the retinal layers. So this is a complete slit lamp for both the anterior segment surgeon, the glaucoma specialist, and also the retina specialist. Coming to the other accessories, apart from the vario view and the filters, you also have an external light source for photography, which you can put on. It also has a diffuser here, which you can use for diffuse photographs of the eye. Then it's also got an attachment for the applanation tonometer, the Goldman applanation tonometer. And coming to the imaging system, it has got a very compact camera. This is the camera. You don't need a beam splitter. This is a compact camera which is 18 megapixel, very high resolution, and has 40 frames per second video, which makes it very fast, and there is no lag when recording the video. So let us look at the software for the SL800 for video capture. It is seamlessly connected to the slit lamp and also to the forum. So you can import all the patients who have appointments for the day, and they automatically open. That is one of the advantages. You don't have to keep entering the names every time, and you can select the patient for either viewing the video, real-time video. As you examine the patient, you can explain the problems to the attendants. You can also capture a video or take a photograph. So once the patient is seated on the slit lamp, you just have to press the capture button, and then the window opens up, and you will be able to, as you examine the eye, you get a real-time video. The other feature is that you have an increased depth of field filter, which you can use to increase the depth of field. It reduces the illumination a little, but you get a better depth of field. And as you examine the patient and his eyes, the attendants and relatives can look at the findings. And the other advantage is when you shift from the right to the left, it automatically shifts. So this is the left eye now, and then when you shift, it automatically selects the right eye. So even for the imaging system, you don't have to keep selecting the eye, it automatically selects the eye. And then you can go into the, if you want to capture a video, then you can go into the video mode, and it starts recording. And when it is recording, if you want to take a still picture, all you have to do is press the button, and it just, you get a capture, and then you can stop the recording. And this is the recording in 2 still photos. You can review these, and this is the video that we took. And if you want to save, you can save the report, and then you can even put your comments there. Or if you want to export it, you can even export the selected photos. You can even edit. If you want to do some editing here, you can always go to image editing. This is a small editing software which is there. You can increase the zoom, also change the brightness, and the contrast can be increased or reduced, and also the exposure. So this is something you can do here and save. You can also keep these settings, so they are used for the next photo capture. Then you can also open a third-party application for editing of the photograph, and you can also insert comments if you want to make a comment about the capture. You can also use the button here to kind of magnify. So this is a very user-friendly software, very good resolution and contrast, great illumination, so you can see even the finest details. It's got the Vario view to examine the fundus with a 90D lens. It's got applanation tonometry. It's got all the other features which is desirable. You can capture great images and videos which can be used for patient education and also teaching residents and for academic work. So in all, I've been using this slit lamp for about 6 months. Very happy. That was the automatic echo mode. So you saw that the slit lamp switched off, and then the brakes came in. You touch it and then it gets activated again. So this is a completely new concept, great optics, great imaging software, and I think ZEISS has done a great job in bringing this top-end slit lamp model to the practitioners. Let us see some of the images that were captured. Today this was a patient who had undergone ICL a few years ago, I think about 11 years ago, and then he came with diminution of vision, and you can see this was slit lamp. You can see that this is nuclear sclerosis which he has developed, and you can see the ICL there. If you want to improve the image, you can do that by again editing it slightly. I'm going to increase the contrast slightly. You can even see the pigments on the ICL. You can see the pigments on the ICL. The vault is good, but this patient has developed nuclear sclerosis. So you can see the different images captured. This is showing the nuclear sclerosis. You can also see the ICL with the pigments there. So you get great pictures, very good quality, high resolution, 18 megapixels. This was a patient whom we took a fundus photograph. Diabetic changes, you can see there's some amount of cupping, looks physiological. This is the other eye, so you get good fundus photographs also. This is a photograph of a post-op patient who had undergone femtocataract, and you can see the nice circular rexes. This is retroillumination. You can also see the very fine folds in the PC. So the resolution is excellent. The kind of detail that you can see, the contrast is superb. So you get superb photographs, and you can also use these for various presentations or publications. This was a patient who had undergone RK, and you can see the RK scars and the incisions there. These are epithelial plugs, basically on sclerotic scatter. They light up. And this is a side view with the scars and extreme flattening of the cornea. This is a patient who had a posteropolar cataract, and you can see the posteropolar cataract, typical posteropolar cataract, wall-like appearance. And of course the resolution is so good that you get excellent specular photographs. This is, you can see the endothelial cells there, and this is something that you can visualize very well and capture also. This is a magnified view. You can see the hexagonal cells. I think overall it's a great slit lamp and a photo slit lamp. Very good imaging capabilities, very high resolution, excellent optics and illumination. And of course the workflow is very easy, the ergonomics, the workflow, everything at your fingertips, and you can use it with one hand. So I think they have a great product.